Hi folks, Dr. Paul here with a video summary. In this summary I want to talk a little bit about Unit 9 and the discussion post, and then I want to spend the remainder of the summary just going through the presentation that I recently did in Portland, Oregon at the American Family Therapy Conference. The annual conference was held there this year. So to begin with, in Unit 9 you were supposed to apply a theory or model of therapy to your case. And I just want to go over a few points. One of them being to remind you that you don't use models like medicine and choose the appropriate model based on the family or client that comes in. I know sometimes the readings in the course room do perpetuate that idea that you should match the model to the client, but really you want to get clear on your assumptions about therapy that you believe to be true. So things like what is your role as a therapist? Are you a coach, an educator, a mediator, a collaborator? There are lots of different ways to conceptualize your role as a therapist. What is an intervention? Is a good question to ask you to uncover your assumptions about intervention. Is an intervention a homework assignment? Is an intervention everything that you say in session? So there's different ways to conceptualize that. What is the role of assessment, both formal and informal, in your work? What is your ideas about health and pathology? Do you view clients through a pathological lens or through a strength-based lens? So I think answering those questions are more fundamental than choosing or picking a model, and certainly picking a model based on the family or client that comes in. That being said, it can be helpful to learn as much as you can about a particular approach to therapy and practice that as much as you can as well, and get comfortable with one way of thinking about clients, and then to kind of branch off from there. Remember, you can always grab or borrow from different approaches at the level of technique, but at the level of those underlying assumptions, that should stay relatively consistent over your caseload. And it certainly can evolve over your lifetime as a clinician, but those ideas are going to change much less often than the techniques that you pick and choose from model to model. So again, borrowing techniques is fine, from different epistemologies even, but you want to be clear about your underlying assumptions and your overall epistemology in terms of how you see your role and how you see clients. So I was pleased to see that you guys are interested in solution-oriented work, narrative work, Milan. I mean, these are all wonderful approaches, and there were some others. And so I would encourage you, if you have a passion for any one of those, to continue reading on. And as I said, in the remainder of this, I just want to go through a little bit of our presentation that we did in Portland last week at the AFTA conference. So we basically talked about the Couples on the Brink project and intensive couples therapy. And to summarize, we see intensive couples work as a subspecialty within counseling, couples counseling. And like us, I think more and more clinicians are becoming aware of the limitations of traditional hourly therapy with one therapist when you have a client that's in crisis, or a couple that's in crisis or in high conflict. So that's kind of was our starting point, not wanting to fit clients into an established framework of 50 minutes per hour once a week with one therapist, and we sort of built our model from there. The first thing we do when we meet with a couple is we have an assessment session, and it's about an hour and a half long, and it helps us to ascertain to what degree are they on the brink, to what degree are they a good fit for intensive couples work. We want to explore their previous therapy experiences and to collaboratively talk about possibilities going forward that fit for them, given whatever time or financial constraints that they might have. The specific assessment questions that we ask are, has the relationship been, ending the relationship been considered? Has ending the relationship been openly discussed? has the question of getting help become a polarizing process where because one says we should get help, the other one is saying we shouldn't. One says we should stay together, the other one says we should split up. So there's sort of that you say black, I say white process with couples. And we want to assess, has the choice to get help become part of that polarizing process? Are they dealing with an infidelity, which at least 80% of our couples are? And if they've had traditional therapy, what has that experience been like? The differences between traditional couples therapy and intensive couples therapy, as I mentioned, the duration, the therapy interval is typically different in that traditionally it's once a week for an hour, and intensive couples work, oftentimes we meet 2 and 3 times per week. Traditional therapy has one therapist, and in an intensive couples therapy model like ours, we have a co-therapy team at a minimum, and then oftentimes we bring in additional therapists to consult with from behind the one-way mirror. The specific assessment questions that we ask are, has the relationship ending been considered? Has it been openly discussed? Looks like a duplicate slide. Paths to the brink, overwhelmingly infidelity, followed by addiction and this idea that clients are living parallel lives. And then I would say that there's a good percentage of couples are dealing with multiple paths to the brink. In terms of determining a couple's appropriateness for intensive couples therapy, certainly their motivation has to be pretty high in terms of wanting to get help. They have to have few financial or time constraints, or they'd be willing to put aside time and financial constraints. So if they're busy at work, they have to be willing to take off work. If money's an issue, they have to find a way to make that happen. We've had people borrow money to attend our intensives. We had a guy one time sell his truck in order to pay for the sessions. We very clearly did not want to be constrained by a body like an insurance company to tell us how to do this work when we know that this format really works well for couples. And we also like to tell them that the $4,500, for example, for our Back from the Brink program, which is 18 hours of intervention, works out to be about $125 for each co-therapist per hour, which is not staggering. And a divorce in many places is going to cost upwards of $5,000, and it could go much higher than that. So that's a little bit of our talk around time and money. Typically, there is one person who is reluctant to attend therapy, and so we want to assess for that and see whether or not the person who's reluctant to participate in therapy has more of a voice, or if the person who wants to participate has more of a voice. Duplicate slides, that's pretty much where it ends. This is sort of a working version of the slides. It was a great experience. For those of you who don't know anything about AFTA, it's sort of a separate organization from AAMFT. It's sort of a dividing place in the field. It's a smaller organization. Again, it's the American Family Therapy Academy. They have conferences and a journal, I believe. And they're a very academic group, but something else that if you're interested in participating in shaping the field, you might look up AFTA. So again, that's pretty much the summary. I just wanted to share that with you. And it was great seeing you a couple of weeks ago over the Adobe. I hope this has been a valuable course for you. Please don't hesitate to stay connected with me if you're ever in South Florida, as I had mentioned. Please look me up, come by Couples on the Brink, say hi, maybe sit in on a session, and good luck in your fieldwork experiences, which should be coming up in the upcoming quarters. So, great. All right. Talk to you soon.